Hi, in this video we'd like to talk about another serious condition that affects a lot of women, which is vaginal cancer. So vaginal cancer is a cancer or presence of tumor or malignancy inside the vaginal canal. So usually these kind of growths appear on the surface of the vaginal canal, on the surface layer of the cells. And usually if you are not detected early, or if you don't treat it as soon as we can, it may spread to other parts of the reproductive system and also the systemic body of the patient. And at that stage, it's very advanced, and treatment will be very ineffective at that stage. So, for vaginal cancer, prevention and early detection is the best approach in hopes for a 100% cure. So, symptoms of vaginal cancer is a distinct one, which is abnormal vaginal bleeding. Now, if you experience postmenopausal bleeding, bleeding during sexual intercourse, and also random times you experience bleeding as well, and also excessively, it could be an indication of vaginal cancer, and you should get yourself checked immediately. You should not be experiencing excessive, abnormal, and random bleeding. Furthermore, you can also observe excessive vaginal mucus secretion. Sometimes you will also experience white patches in the area, and in some cases we experience stench as well. So if you experience these symptoms, it also could be indication of vaginal cancer. And then furthermore, you will also experience symptoms for advanced patients, symptoms such as disruption in urination, pain during urination, bleeding during urination, constipation, bleeding in your stool, and affecting your functions of the bladder as well. These are all indications that the cancer is already sufficiently advanced and has already spread in its local area. So the key symptom that we look for is abnormal bleeding and also stench, excessive mucus. This is already signs of a potential cancer presence. Get yourself checked. You don't want to wait until the latest symptoms. So treatment here at Anthem Hospital is that once you are properly diagnosed, we will do a full gynecological examination. We will also need to do a transvaginal ultrasound, and then we need to do a vaginal biopsy as well. So we'll be taking a tissue of the vagina, scrape a small piece of tissue, and then we will need to do a biopsy to actually see if there's any presence of cancer that we need to be concerned about. So treatment here at Anta Hospital, usually it's a combination of surgery and radiation therapy. That is the best chance that you can to have a chance of beating this cancer and also a cure for this cancer. Some hospitals will also recommend traditional Chinese medication, and now it really depends on the individual's case. Some cases are slightly less advanced, some are much more advanced. So we will give you a combination of either TCM, radiotherapy, and also chemotherapy. Now, if we do it in a combination, then we can reduce the scope of surgery, so we don't have to remove the entire vaginal canal or large pieces of tissue. If you use a combination therapy, we can remove only affected regions, and then we can preserve organ function. That is the most important thing for us here. So if you do this early, we can prevent the spread. So I'd like to come back on the cause for vaginal cancer so that you can be better prepped with this condition. Vaginal cancer usually is a secondary cause. It's usually caused by another form of cancer. Usually it's cervical cancer that's causing it. So cervical cancer, it can very easily spread to the vaginal canal because of how close they are, very close proximity. Cancers of the bladder, the rectal can also lead to vaginal cancer because they're all within proximity to each other. HPV infection is likely the primary cause. So usually HPV leads to cervical cancer, and then cervical cancer leads to vaginal cancer, which is why here at Anta Hospital we always recommend patients who have not been vaccinated to get vaccinated as soon as possible. And those of you who have been infected with HPV infection, don't wait for it to show symptoms, because it can easily lead to cancer formation, especially high risk HPV. And here at the hospital, we also offer HPV treatment. That's why you can prevent yourself from going for radiotherapy, chemotherapy, receive the HPV infection treatment as early as you can, as soon as you are diagnosed with HPV, so you can prevent all this unnecessary treatment at the end for vaginal cancer. So I hope you've learned some important information that vaginal cancer is usually a combination treatment that we can treat it, and we usually prevent it by treating your HPV infection in the first place. Antai Hospital offers a full refund guarantee, full contractual treatment for HPV infection patients that you will recover within 6 months after receiving our HPV treatment. If you don't, then we offer you a full refund guarantee. Get in touch with us via the website, visit the website, visit our YouTube channel, so leave me a comment down below.